After 10 years as President of the World Hepatitis Alliance, my term has come to an end and I'm stepping down. In those 10 years, all of us, particularly you as members, have really done something extraordinary. Through your awareness raising, your advocacy, your policy influencing, we have turned viral hepatitis from this little known disease with virtually no profile or priority into something that is so firmly on the global agenda and is right up there with HIV, AIDS, TB and malaria. Of course, we started quite small. When we came together in 2007, it was just to raise awareness. And so the Alliance was actually established just to run World Hepatitis Day. But of course, we soon found out that there were many more things that needed to happen, and that just raising awareness on one day was certainly not enough. And as a result, we've really grown and blossomed as an organisation. And I think what we've managed to achieve through working with governments and getting 3 World Health Assembly resolutions, the first one making World Hepatitis Day an official day, as you know, one of only 4 disease-specific official days, which therefore is a big deal, to then a resolution really pushing countries to establish national viral hepatitis plans. And then last year, the resolution that accepted the global health sector strategy and critically the goal of the elimination of viral hepatitis by 2030. Achieving this has not been easy. We've never had the money available to these other disease areas. We've really had to struggle to get things to happen. And one of the challenges was that the Global Hepatitis Programme at WHO, which was established as a result of our actions, got moved into the HIV department. And I remember being really worried at the time that yet again viral hepatitis would be overshadowed by another disease. But in fact, it turned out to be an incredibly positive step and actually has allowed WHO to put more resources into viral hepatitis than would otherwise have been available. And that actually came to fruition at the World Hepatitis Summit last month. WHO worked incredibly hard on the programme, on getting programme managers to come from all of your countries, or at least as many as they could manage, to basically provide an event that is unique in the world. And I was delighted to have had the opportunity to say goodbye to many of you in person. And I really think that summit set the stage for what we need to do now, which is really turn elimination from a concept and a goal into tangible action on the ground that actually stops new infections and that saves people from dying. And I know that I am leaving the World Hepatitis Alliance in incredibly good hands. All of you working on the ground, but also an incredibly competent team here in London at the Alliance. And of course, we have an excellent board and a new president, Michael Ninberg. So I'd just like to end by saying I wish all of us, because clearly I am still a member of the Alliance as part of the Hepatitis C Trust in the UK, all of us tremendous success in delivering the next stage of the elimination of viral hepatitis by 2030. Thank you and goodbye.